So some people ask why I went for the board certification to be a holistic board certified family nurse practitioner, and that is because I saw from my years of being in the acute care in the hospital setting that sickness does not mean that that person is worse off. In fact, nursing has brought forth in our theories, and now we're studying it and seeing it really as nurses do on their long shifts dealing with every aspect of the person, psychological, socially, with their family members, and their fears with what the pending tests are the next day and what the results might be. We're there for everything, and we cherish life. And we want to keep them around the best that we can, and we're going to be doing the best. And this has taught me so much about holism, to see the whole person, that there is a time where the person might be looking very sick, very ill, but in some ways they are at their healthiest. They have let go of that physical self, and now they've come to a certain peace, a certain understanding of life, of themselves, of others. So in some ways they're healthier. And this is what nurses have seen. This is what nurses encourage, that when we see a person, it's not the diagnosis. In other words, it's the person behind that diagnosis. We don't go from room to room and saying that is the transplant patient, that is the diabetes patient, that is the hypertensive patient. We really understand their whole being. What was it that made them happy in life? What does make them happy, to give them that little bit of happiness and pleasure, which is really what's worth the most when it comes to all these expensive and invasive testing and interventions. So holism is really where the center of healing is.